Good morning, everybody. My name is Joel Green. You are listening to Senior Moments. Our topic today is how can the Santa Clarita Senior Resource Alliance help you? On this, we're going to talk about today with our guests. Our guests today are Mary Demkowski and Flora Greenhill, Hospice Community Liaison with Assisted Home Health and Hospice. But first, we're going to talk a little about the Santa Clarita Senior Resource Alliance. The Santa Clarita Senior Resource Alliance is made up of a group of professionals dedicated to providing resources and services to help the elderly and their families in Santa Clarita and surrounding areas. Some of the areas of expertise are represented in this alliance are audiology, geriatric care management, elder law, reverse mortgages, senior real estate specialists, and in-home care services, including hospice planning, which is what one of the subjects we're going to talk about today. Some of the out-of-home services include placement services, assisted living, and memory care. Let's begin today with Flora. As I said, Flora Greenhill is the Hospice Community Liaison person with Assisted Home Health and Hospice. Good morning, Flora.
Good morning, Joel.
What is hospice?
Well, hospice is a specialized care, and we help patients with advanced illnesses. We help keep our patients comfortable and help them have as good a quality of life as they can possibly have at this point in their illness. And we, in addition to helping our patients manage symptoms like pain, we also provide a lot of emotional support and provide a lot of support for the family.
Like what? What does that mean? What in the way of support?
We have social workers, and we have spiritual counselors and counselors. You know, a lot of the time when someone's on hospice and their symptoms are managed, the pain is managed, we're helping so they're not in any respiratory distress anymore. The family is going through such a difficult time, and they're grieving. They have a loved one whose life is limited, and they need a lot of help dealing with it and handling it, and we're there to support them and listen to them. So much of what we do is listening to our families.
Hospice, I think, has a kind of a scary connotation to people that are not familiar with hospice. When we at Home Instead Senior Care, we deal with hospice patients very frequently. But most people don't. Most times when they call you or you're recommended to a family, it's their first experience with hospice. And it's very scary to think that my loved one is going to be put on hospice, because the old connotation used to be that's a death sentence.
I think you're right. I actually used to think that way myself. When I first knew of hospice, I thought it was a place where people go, and I thought it was only for patients who had cancer or AIDS. It was in the 1980s, and I thought it was for people who were at the very, very, very last days of their life. Actually, hospice is a very supportive service. We are in seeing patients at least twice a week with our nurses. We have a home health aide who comes in 2 to 3 times a week. We have counselors, we have spiritual support, we have social workers who sit and talk with the patient and the family. We can do things like life review.
What is that?
Life review is when a patient just kind of wants to remember things that happen with their life, and sometimes they just want to tell a story. They want to tell a story to our social worker, to our spiritual counselor, to our nurses, and they want to share that story. They want to share that story with the family. And it's kind of like a legacy that they can leave behind. And it helps a family come to terms with this thing that's happening to someone they love and someone they're so close to.
You know, as and this is it's one of the very important things that you've touched on, and I know that at Oakmont, life review and sharing somebody's life with loved ones is very important. And I know that at Oakmont there's a memory care unit. What is that, Mary?
Well, a memory care unit is a specialized environment for seniors that are dealing with memory loss through Alzheimer's or dementia, and it has a home-like feel, but it specializes in meeting the needs of those residents who, suffer from the disease, who need that extra attention. And, like Flora said, creating that legacy is so important. And one of the things that I love that we do at Oakmont in our Traditions Memory Care is we create, for each resident, we create outside their door. It's a life legacy, and they can put, the families can put pictures in there, can put things from their past that when the resident sees that, not only does it remind them of their past, but you're able to, for the staff, it enables us to be able to start a conversation with them and tell me about this time. And so it's just so important for them to have that legacy, and it helps, both the residents, the families, and the staff just to connect with that individual.
At home instead, when we start service with clients that have memory problems, whether it be Alzheimer's or other kinds of dementia, we frequently bring in essentially a life journal. Mm-hmm. And a life journal is a way to record some of the events that were significant to people. And of course, the logical question is, how could you record events that are significant to people if they have no memory?
Mm-hmm. And oftentimes, those long-term memories are still there, and you bring out a photo, and all of a sudden all of that comes back to them, and they're able to tell about it and to be able to write that down. It may be something that their family didn't even know about, but yet their loved one is able to recall that, and with the help of someone like your staff at home instead, or a caregiver, or even a volunteer at Oakmont, we can help them preserve those memories for the family.
And I think that families don't realize how important that is, to be able to do that, to have, as Flora mentioned, to leave that legacy. Mm-hmm. One of the things that we should mention to our audience is that phone lines are open. You can call and ask your questions at 298-5487. You could ask questions of Flora, Mary, or myself, Joel. Continuing with that, in hospice, what are the things that people should look for in a hospice, Flora?
I think one of the things that you really want to do is ask questions. When you first speak to the hospice company, what is your first conversation like? How is the person responding at the other end of the phone call? Ask if you can have somebody come and meet with you. Not necessarily to start care. I mean, this is a big step, and you want to make sure that you understand the service. You want to make sure you understand how it's paid for and what's going to be provided. So see if they can come and meet with you face to face. You can ask how long the company has been in business. Are they established in the community? Excuse me, do they have local representation in the community? Ask them how they handle urgent needs. Hospice is available, excuse me, pardon me, 24 hours a day, 7 days a week. You want to know, how do they handle an urgent need if your loved one is going to run into a problem at 10 o'clock at night or 2 o'clock in the morning? How quickly is the staff going to respond? Will they send a nurse who knows what's going on with this patient, who's aware of the situation? You can also ask them questions about something called crisis care. Do they use nurses who are employees of the hospice, or some hospices actually have to hire outside nurses from a registry who are not familiar with the situation that the patient is going through, with the condition of the patient, and they also may not be familiar with the culture and policies of that particular hospice. So you want to make sure that all of their nurses are actually hospice employees.
And this is a question that I'm going to pose to all of us, including myself at the end. Are all of what we do and what we represent, are all created equal? Are all hospices the same? If I call up assisted home hospice, if I call up Oakmont, if I call up Home Instead, are all of the things that we represent the same, and no matter who I call?
I think that's a very, very good question. Medicare has certain criteria for what every hospice has to provide. We have to provide nurses. We're supposed to be available 24 hours a day, 7 days a week. We have certain criteria of diagnoses that a patient has in order for us to admit them to hospice. But within that, every hospice has their own personality. And
what does that mean?
well, I think sometimes it comes down to the personality of the nurse or the case manager. I think it comes down to the culture of that hospice. I can tell you at Assisted, our company is family owned and family run. I mean, we've been in business a number of years, 26 years. And I think that's important when you're looking at someone who is you're going to place a lot of trust in a hospice provider. You want someone who's stable, who's been around for a long time, and you want someone who's kind. You want everyone kind, from the staff in the office to the home health aide who comes, to the nurse who comes, to the person who's going to deal with your crisis situation at 3 o'clock in the morning.
How about in regards to Oakmont of Santa Clarita, Mary?
Well, I think
are all assisted livings created equal?
Again, very good question, and I think some of what Flora shared, I absolutely agree with. In assisted living, I mean, we're all licensed under Title 22, and there are definitely, regulations that we have to meet and abide by. But I think when you're looking at a community, what is it that that community does that maybe goes above and beyond just the basics? Providing that care. But, I think to Oakmont, I mean, we are family owned as well, and we are the 19th Oakmont senior living community. And from what I've witnessed just in this whole process of going through from, groundbreaking to opening, how involved the owners are and how much their heart is a part of this community, and wanting it just to be the best, from the design of the building to who they're hiring for staff and what the standards are, and just being able to be a part of a company that really puts the needs of the residents at the top of the priority list, and having a company that has some additional services that maybe aren't offered, such as nurses 16 hours a day, 7 days a week. Very comforting to the families to know that we have that, and we're able to offer a diabetic wellness program because of that increased nursing coverage.
And that may not be available at other assisted livings?
It may not be. I mean, it's not something that's required for a community to have a diabetic program, but it's very important to our owners that we offer that. And so having those nurses there 16 hours a day, 7 days a week, we're able to, the diabetic program encompasses, being able to assist with blood sugar checks or insulin injections. We have a diabetic friendly menu that our chef works closely to develop, and then we have a support group, a diabetic support group, and a fitness program, so it all ties in. And that was actually created by our owner's daughter, who's a pharmacist, and she pioneered this program, and it's a very important part of our program.
And that may not be available at other facilities.
It may not be. And so if you have a loved one that's diabetic, a senior, and you're looking at communities, that might be something that would be of importance to you, knowing that is offered.
Phone lines are open, 298-5487. In home care, that's also the case. Not all home care companies are created the same. In California today, there is no licensure for home care. And for the real companies in Santa Clarita, that becomes really kind of a very important thing. What I like to tell families when I speak with them is that your mom or dad can have a home care aide that was just let out on work release from Pitch's Detention Center on Friday, a convicted felon, and the state of California says that person can go in the home of your mom or dad. That's pretty scary. That's going to change come January 1st when home care companies will be required by California to be licensed. But as of today, that is not the case. Home care companies need to be, when you're looking, should you have a need for home care for a loved one, locally owned is a very good thing. Experience in doing this, again, another very positive thing. How do they respond? How does that home care company respond to you? Do they answer the phone when you call, or does it go to voicemail or an answering service that messages are picked up every 3 or 4 days, whether they need to be or not? So these are kind of the questions, or at least some of the questions that we urge people to ask in regards to home care. When we come back, we're going to talk more about how can the Santa Clarita Senior Resource Alliance help you on Senior Moments, brought to you by the Santa Clarita Senior Resource Alliance. I'm Joel Green on Santa Clarita's hometown station, AM 1220 KHTS.